I think there's a slide, Fernanda, the first slide. While we're getting the slide ready, welcome everyone to Track H. You guys made it, 48 hours, yay! And let's show everybody where everybody's from. So go ahead and type in the chat where you're calling from. Let's see how many countries we got. The US, Mexico, Colombia, Brazil, India, Ireland. Wow. Chile, Canada, Colombia, Mexico, Nigeria. I want to see who is the further, Chile. Hong Kong. Okay, I guess you guys could be the winner. Venezuela. This is awesome. So we have teams of the Czech. Yes. Martina, thank you for joining us. Awesome. All right, well, welcome everyone. We can go ahead and get started. I think there's a slide before that, Fernanda, if you can move back up. There we go, one more. Excellent. All right. So welcome everyone to the Latin America versus COVID-19 challenge. This is the sixth of a series of hackathons from the MIT COVID challenge. It started back almost 3 months ago now, where a group of students came together from MIT and they did an ideation hackathon that went so well, and they wanted to address the most pressing issues that we are going through during the pandemic when it starts surfacing. And 2 weeks later, they put together in early April, Beat the Pandemic 1 event, which had about 1,500 participants, as you've heard. And it was an amazing experience dealing with the issues as all the states and countries are shutting down. And then 2-3 weeks later, there was the Africa Hackathon that addressed the issues that are pressing in the continent of Africa. And there was the COVID truth. Next. You can guys count to be with us here for about 2 hours. We hope to be done around 3:30 based on the number of presentations that we have. Just take a note, there's our hashtag on social media. Please do tag us as you write about the event. And next. This is the list of the amazing partners and collaborators that we had throughout this event. Without them, we would have not been able to carry this event. So we thank you all for all of your support. And next. And Fernanda, you're off the presentation. There we go. Thank you. And here you guys will see our amazing judges that they were kind enough to join us this afternoon on a Sunday, on Father's Day for some, to help us review and give you feedback on your work for you've done in the last 48 hours. So I'm gonna let our judges introduce themselves. You can go ahead and unmute and introduce yourself. You wanna go first, Henriette?
Okay, people. Hi, I'm very thrilled to be here with you. I'm a manager for the last 5 decades. I got my graduate degree at MIT Sloan School of Management in 1974, and I worked in many organizations, but for the last 3 years, I'm dedicated to the entrepreneurship and the innovation technology-based startups as a mentor and also as an investor, an angel investor. So I'm very interested in the health system, and thank you.
Camilo?
Yes,
Hola a todos y todas desde Chile. My name is Camilo Erazo. I am the CEO of the National Center for Health Information Systems in Chile. I've been working in digital health for the last 8 to 9 years, I guess. And for the last 3 years, I've been the CEO of this nonprofit organization that seeks to address and close the gaps that we see in information technologies and health. So I'm thrilled to be joining you today. And this is a very relevant subject. So I'm very excited to see what you guys came up with. Looking forward to it.
Excellent, thank you. And Roberto?
Yes. Hi, everyone. So I'm very excited of being here today and listening to your pitches and all your great ideas that I'm pretty sure you came with. I'm a professor researcher at Technological Monterrey, got my PhD in MIT in urban information systems. And I guess I was put on this track by the organizers of the event because at my university at Tec de Monterrey, I've been leading an effort called, it's a webpage, Mexico VITS 19, which is a kind of information systems platform online where we publish data related to COVID and do an effort of visualization. Thank you.
Excellent. Thank you so much for being with us today. Next slide. So this is our hackathon process. You guys all saw it in the first day. We started on a Friday night where on this track H, we had 145 participants and hackers, and they started by pitching ideas, and we generated 66 ideas. And I don't know if I guys told you for my team, but we were the highest number of pitches among all 10 tracks. So great job everyone on that. And then the teams out of the 145 and 66 ideas, they formed the 23 teams and they worked on their ideas throughout yesterday, Saturday, and this morning, Sunday. And now we are down to 20 ideas that's going to be presented today. I just have to thank the team that have been working nonstop for the last 48 hours for the amazing work, and the progress has been really inspiring to see where they started with just a simple pitch with 1 or 2 sentences, and they build it into really exciting ideas, and how every time we do a healthy check, how the improvement and the progress is made on the team. It's just very inspiring. So I thank you all for putting the time and effort and your ideas and your heart and minds into this event. Next slide. Next, so these are the judging criteria, just a reminder. Go next slide, please. These are the same judging criteria we talked about earlier. Really, the judges was going to be looking on the impact of your idea, how innovative it is, how you're planning to implement it, and is it feasible, and then about your presentations. So these are the things that you'll be judged on. These are really based on the history of the MIT Hacking Medicine and the other COVID-19 challenge that we have used in the past. Next. All right, a few logistics for today that we're all on the same page for the hackers. This is similar to what we did on a Friday night, guys, when you did your pitches. So again, reminder that the presentation is being recorded, and the recording would be available later on for all of you to access. There are multiple team members that can present and answer the Q&A if you need to. You will have 3 minutes to present and 2 minutes for the judges to ask questions. Where is Fernanda on the screen? So Alfredo is not going to be with us all the time here today, and he was our sign holder, but now we got Fernanda. I do not see you. Here we go. She's waving number 1. You might want to try again to pin your screen. I want to see if we can get you to the first. Here we go. Excellent. All right. So as the presenters, as we guys practice in the other pitches, you have 3 minutes. When you have 1 minute left, Fernanda is going to give you the visual cue that you have 1 minute left and waving her sign. And then when you have no more time, she would give you the sign for that as well. So just keep an eye on it, and we have a lot of teams to present, and we're gonna need to stay on time.
I'm sorry for that. It might be easier for you if you pin my video. If everyone can look at my video and go to the 3 dots and press the pin this video option.
If I pin you, then you take over the screen and I don't do the presentations.
Okay.
All right. I think we'll just, when you first start presenting, just make sure that we can see Fernanda for the cues. And all All right, and then when you're presenting, I would ask that the way this is going to work, as you know, there were no sign-up sheets, so the teams are going to be presenting very random numbers. And what we're going to do, Ignacio in the chat room, he's going to give you about 5 minutes notice before your teams come to present. So keep an eye on the chat room. It's also on the slide. We're going to say which team's going to present now and then which team is going to present next. So you will get your 5 minutes notice from that. And I think that is it. Other than that, we should be ready to get started. So let's go to the next screen.
We have someone who raised their hand.
Okay.
So go ahead and ask.
Oh, I just raised my hand because I will be the first presenter.
Oh, okay. Thank you. Let's pull your slides up. So for the presenters, when you see your team name or number that you're gonna come next, actually, when you see your name, your presentations up, then raise your hand. So do not raise them unless you get to see the presentation and your team number is up. And I would say to have all your team raise their hand, and Fernanda would let the presenters unmute, but that way if there's a Q&A and anybody on the team want to answer these questions, will be easy to identify you. Okay. Raising hands, I think we practiced this enough in the last one, but if you look on the bottom of your screen, if you hover, there is a participants tab, and if you click on that on the right side of the screen, you're going to see a chat, and within there you're going to see the hand that you can raise, and these are the steps. All right, next screen. Right, and team 8, you guys are up now, and after that is going to be team 26. For the judges, just a reminder that you guys have the forms, and you complete one form per team, and I will state the name of the team in the end when they finish to make sure that you guys capture that. All right, let's go team 8. Fernanda, can you move to the next screen? There we go. And do we have team 8 unmuted?
Yes.
All right, we're ready when you are.
Next. There are over 454 million internet users in Latin America. Social media platforms are increasingly susceptible to fake news. Influencers and average people alike can fall victim to widely spreading inaccurate COVID-19 information via social networks. According to an MIT study, false news stories have a 70% higher chance of being retweeted compared to real stories. With COVID-19 on the rise in the Americas, it's crucial to combat the intentional and unintentional spread of misinformation to prevent adverse consequences on public health. We propose a solution in 2 parts. First, integrating social media on the large scale and a technological component on the individual scale. Next. The first part of our solution is a social media movement to spread awareness. We will push a hashtag called Share Your Sources and encourage Latin American influencers to use this hashtag. It will work like this. Whenever they post any COVID-19 statistics or advice, they will also include a reliable source. Their followers, when reposting or retweeting this information, will include the Share Your Sources hashtag. This will create a domino effect, encouraging reliable news that links back to a credible health authority. Next. The second part of our solution includes our own platform to help individuals become better informed. We have created a website to integrate all aspects of our project. This would include 4 primary components: reliability rankings of news sources, an interactive COVID fact-checking chatbot, and searchable and easy to understand summaries of expert-verified COVID reports shared by sources such as the Mayo Clinic. It will also include links to the original publishing of the sources such as a research study. Next. The application is reliable, fast, feasible, and scalable. It is non-third-party reliant, so it is neutral. The chatbot is accessible to answer questions 24/7. The option of multiple languages enables implementation in many regions. Its flexible, web-based social platform generates high potential for growth and expansion. Next. Our business model is simple. We are looking at a business-to-business and business-to-customer hybrid model. We will create partnerships with fact-checking organizations, news providers, which will be part of this 4FN platform through a membership fee, which will allow them to be certified as part of a reliable consortium. Users will also receive certified information, up to 50 articles for free. In case they want to have access to additional features, users can pay a fee determined by the market in Latin American economy during the pandemic. Next. Our diverse team includes proficiency in software design, language competency in 5 languages, and experience in working with multilateral health institutions. Join us in combating the spread of COVID-19 misinformation in Latin America by promoting users to link to verified studies. Thank you.
Excellent. Thank you very much. You set the record right for the good start for the event on time. So thank you for that. Judges?
Okay, I have a question. This is Roberto. So I wasn't clear when you presented this idea, which is great, of giving some kind of likelihood of how likely is that a news is fake. How do you plan to attempt that work? Is it something like relies on a tool, or is it like human based to do that classification? Thank you.
So we're hoping to have, oh, by the way, I'm Esther, I'm on team 8 as well. We're hoping to include a combination of both. So we're planning to do a machine learning algorithm. So for the training data, we're partnering with other organizations with similar missions, and some fact checkers are going to hand label data, and we're going to feed that hand labeled data into a machine learning algorithm, and that algorithm would learn which data is fake and which is real. So it would be a combination of machine learning and human tagging.
I see. Okay, thank you and congratulations.
Thank you also for that presentation. Maybe you mentioned it and I missed it, but what's the sustainability or the viability of this of your solution?
Hi, my name is Tammy. Yeah, so as you see in the presentation, our business model it's component by 2 parts. One is business to customer, and the other is business to business. So for the business to customer, we were thinking that we can have the application for free, but up to 50 articles. So if a person wants to receive more than 50 articles, but also wants to be part of the network and receive also extra features, we were thinking that it can pay also an amount that is no more than $1 per customer, but also them to be part of the membership, they will also have to pay like a fee. So we also check on internet of other websites are doing kind of the same, but not the same. And we saw there ask about $5 per month and $50 per year. So we were thinking that also we can have that part in our model.
Guys, that was about it for your time. Thank you.
Okay.
Great job. That was team 8 for the judges. And next we have team 26. Right, and after team 26 will be team 30. So you guys can get ready. All right, Valentina, we have you on.
Yes.
All right, we're ready when you are.
The COVID-19 has affected everyone. In its beginning, when it came to Latin America, many people, for lack of information and getting carried away by the fake news, did not take the appropriate measures. Next slide. Many fake news were going throughout social media, like, have you ever heard that COVID-19 does not exist? Or that it exists but cannot be transmitting among people below 40? Sophia, my friend, believed all that COVID-19 can't kill you, until she died in the hospital because of that. Next. Now talking about a country, in Mexico, more than 44% of the news on social media are fake. We know that many people have been carried away by this false information that they have been receiving online, putting themselves and their loved ones at unnecessary risk. We know that we cannot prevent them from leaving their homes for work or to acquire the necessary supplies, but we know that we can inform them to take the appropriate measures and not get carried away by the fake news and thus protect their safety. Next. Machine learning will be used to collect and verify information from trusted sources like the WHO and the CDC to our web page and our WhatsApp chat. Next, it will be stored in a blockchain database to keep the information reliable and secure, and it will be published by next, the website, and next, the chatbot, that it makes it accessible to everyone. We ensure that the information you will get is not twisted because it will be encrypted by the blockchain. It's so that no one can use the data out of context to mislead the people. With our chatbot, Alice, we deliver the information directly to you by using WhatsApp or Messenger in an efficient, trustworthy, and easy way. I hope that you can use Alice to stay safe and be informed, unlike Sophia. Next, the value of information will be obtained, checked, and disseminated so that it reaches everyone with the tools that we can develop. It only took 5 minds, 1 motive to accomplish this masterpiece, and it takes only 3 months of hard work to finally help 33 countries. Next, this is only the beginning. The truth always comes out. Next. Thank you.
Thank you very much, judges.
Hi. Very good presentation. I like it very much. And I would ask, how do people will know about Alice? What are you going to do in order to spread your application for people to know it?
Hello, this is Edwin. I'm part of the team. So we'll use crowdfunded in order to raise money for as one part of the body that we'll use for this application. So basically the idea is that we'll be using some advertising on some social media to create conscience on the people, and also that's going to be part of how we will be promoting our app, and at the same time we'll be raising money. So the idea is that we'll use this approach to kind of hit two birds with one stone. So by using social media, we will only promote our chatbot or our website, and at the same time we'll be raising money. So that's the only kind of interaction that we'll be having in there. Then the approach would be like promoting only using the chatbot in order to get news and not going directly to social media.
Thank you.
Any other questions from the judges?
One more question. Thank you. Congratulations for your presentation. I like it. One question. I'm not clear on something. So do you think you should partner with governments for this, or just keep it aside from governments? I'm thinking like with public health authorities and all of that.
So we think that we will partner with the not government institutions, but the institutions that are not like polarized. We will give the information to the people, and yes, we will get some help from the governmental institutions, but that's not our primary source of information.
We are out of time. Thank you very much. All right, and that was team 26. Next we have team 30. And after that will be team 80 next. Who do we have team 30 online?
Yes, we are online.
Oh, excellent. Hi, Fernanda. All right. Just give just a minute to complete their sheet and we'll get started.
So is everybody from my team, because I can see people, if everybody's online?
Yes, I'm here.
Okay.
Yes.
So yeah, we can start it.
All right, we're ready when you are.
Okay. True and valid information is what we want to spread. We are reaching everyone with the right information team, and this is our goal. The coronavirus crisis exposed even more the huge social gap in Latin America, as we are current epicenter, with 50,000 deaths just in Brazil. Misinformation and fake news is spread as fast as the virus and can be equally lethal, especially for vulnerable communities due to pass the slides, sorry. Yeah, so the another one. Okay, so due to lack of information, poverty, lack of government support, lives being risked because of fake news. Without government support, these communities create their own organization with leaders and local voices to help one another. Our project aims to bring together the different ideas of community leaders as a way to empowerment to find solutions. It's a mobile platform. Oh, sorry, past, because I totally forgot to. Yeah, so we want to connect local leaders in past. Oh, can pass the, yeah. Yeah. So it's a mobile platform where local leaders and organizations can access healthcare information and news from reliable sources as World Health Organization and discuss to other leaders how they transmit these information to their communities. So the interface of our project is full of news for OMS and reliable sources, and then they can get in contact to each other to find solutions for the communities or change ideas and pass. So here you have a scheme of the company formation. So local leaders, we're gonna be supported by donations or even subscribe for social programs editorials. Pass. And this is our business model as well. So that's it, the project basically. Thank you. Oh, pass? Yeah, so this is the last one, I think.
Thank you so much.
Thank you.
Judges?
Yeah, I think I would need to see that business model slide to better understand how you, because the relationship with the local leaders and how they get support in a very material and specific way is important. So how would you go about that?
Actually, our platform means to be a change of ideas, because the communities, they already have organizations and ways to inform people, but sometimes what works for one community can work as well to another community who is not achieved this goal yet. So if a local voice converse with another local voice, they can find together solutions. Because we are outside of the community, so we don't really know what's their problem. They know what's their problem, and they already have voices into these communities and projects and programs because of the absence of the government there.
We can speak the group or only Fernanda?
The group.
You guys still have about 30 seconds.
Our obey is empower community voice, because here in Brazil and in other places of America Latina, they already have groups to spread good news. So we want to empower their voice.
Thank you very much. And that was Team 30 for the judges to score. And next we have Team 80. And after that will be Team 36 up next. So do we have Team 80 is online?
Hi, can you hear me?
Yes, we can. Right.
Perfect.
You can just give us a couple of seconds, get the judges to complete their scoring their card. All right. Get started.
Perfect. So, nearly 300 people died last month due to ingesting methanol, believing it would help them fight coronavirus. The thing is, it wasn't the consumption of methanol that really killed them, rather the consumption of fake news. Misinformation has consequences, and sometimes they can be lethal. Next, please. According to Forbes Colombia, 70% of Latin Americans, more than 450 million people, are affected every day due to confusion created by fake news. And this has to stop. Next slide, please.
Sorry, we're just gonna, here we go.
Sorry, but I asked the slide and you didn't move it before. So can we go over? I don't know, I said like the next slide and come on.
Yeah, that's right. Let's start from the first slide, Fernanda, please.
Yeah, please.
Okay.
Perfect. So
what
nearly, so nearly 300 people died last month due to ingesting methanol, believing it would help them fight coronavirus. The thing is, it wasn't the consumption of methanol that really killed them, rather the consumption of fake news. Misinformation has consequences, and sometimes they can be lethal. According to Forbes Colombia, 70% of Latin Americans, more than 450 million people, are affected every day due to confusion created by fake news, and this has to stop. Next slide, please. But where's the issue? Irresponsible use of medication, non-compliance of health indications, even physical attacks to medical personnel. Managing fake news is a complex task, as misinformation spreads in real time from multiple sources. It's actually pretty hard to classify articles when they're not objectively false. Next slide, please. Our solution is called MI Truth, an easily accessible plugin that will allow users to influence the credibility of any news. Just browse through your favorite websites and articles available, and they will present a tag with the respective trust indexes, or Tindex, as you can see on the screen. Next slide, please. This index represents the community opinion about the article and how trustworthy it is. Unlike other solutions, MI Truth encourages people to interact within a diverse community with multiple perspectives that are challenged every second. Next slide, please. At the core of the plugin, a web platform showcases the possible user interactions on both the article and the user level of credibility. Can you play the video? Users interact in a distributed network, categorizing an article credibility as a group while the system stores checked posts in an immutable database. Post credibility is reflected in the Tindex, represented as a combination of users' reliability score and their opinion about the article, being constantly updated just as weights are updated in a neural network. Users that detect the nature of news correctly gain more influence than the ones that unintentionally or not cause the opposite effect. Next slide, please. Anyone on the internet can use MI Truth, as it has a simple and straightforward design. MI Truth is a nonprofit organization focused on people. For the pilot version, the main core of its functions are going to be COVID-19 centered, but in the future, the type of news displayed can range in most categories. Nowadays, big companies already invest resources in their fight against fake news, so we expect our solution to be highly accepted, thus creating partnerships with them and making this a reality. We strongly believe that our solution with today's technology resources is feasible and scalable. Despite, next slide, please. Despite coming from different parts of the world, we all have been affected by fake news, and we believe the human mind still has more power than the strongest of deep learning algorithms. So let the human mind be the classifier. Let us humans decide where to place our trust. Next slide. Thank you.
Thank you very much. Judges?
How long do you think you'll need to improve, to implement this project?
Actually, the video we show, we created like a prototype only using some clone repository of a really known website to make ratings for coding things. And it's actually not that hard to make the implementation. I think the maturity process of getting people start using can take a little more, but because of it's engaged already with the most popular social networks, it shouldn't be that difficult. It shouldn't take that amount of time. So
there'll probably need to be a few months, like 3 months or 6 months.
Yeah, it's at least the development part. It's not that complex. There's still some technical things that we should be addressing along the way. But using today's technologies such as cloud computing, and with at least what I know about something like the structure on AWS or Azure or Oracle or any of the providers, it's perfectly possible to do it.
Okay, thank you.
Maybe if I can add just a quick comment to this question.
How do you assess credibility of the sources or of people?
When you get into the platform, users have assigned their own users reliability based on how they in the past has rated or not some new. For example, if I upload something, if some new it's uploaded in the platform, and I decided to put that is fake news, and actually it's not a fake news, I'm going to be, I will lower my score of reliability, and someone who actually said that it was a fake news and it was correct, he's going to improve the score. So then every new has this average of using every user reliability score with their opinion, and that calculations create the news reliability score.
Thank you so much, guys. We're out of time. That was team 80 for the judges to score. And next up, we have team 36. And after that's going to be team 29. Do we have the presenter from team 36?
Yeah, I'm here.
Just give us 30 seconds, get the judges to complete their forms.
Okay.
All right, great. Let's go ahead and get started. We're ready when you are.
Okay. Okay, who do teenagers listen to? Other teenagers. Hi, my name is Isabel Garcia, and our project is the COVID teen website. Next. Often young people don't want to or don't have the time to read complex articles to correctly inform themselves about COVID-19. They constantly believe information from biased or ignorant posts they see on social media. We believe they need an easily accessible and understandable outlet where they can find trustworthy information from reliable sources. Next. We're targeting Latin American teenagers since they tend to be misinformed because of social media and rumors. Gen Z background. They want to learn in an immediate and easy way. Since they're used to using their phones, they don't read as much. They have a short attention span, so a visual and interactive solution will catch their attention. And teenagers spend a lot of time on their phones, so a trustworthy digital outlet will be the best solution. Next. Our solution, the COVID teen website. Our website will be our outlet to provide teenagers with the correct information regarding the COVID-19 crisis. In the platform, we will upload articles and statistics from reliable sources and create relatable content that Gen Z users will understand and remember. Next. It will be divided in 3 sections. The first one being the articles and statistics section. Here we will upload articles and statistics from reliable sources so they can read them in detail. Next. The second section is the featured or highlighted section. Here we will take the most impacting information from the articles and write descriptions and make short videos from a teenager's perspective so they can relate to the content and understand it better. Next. The third section is to share with other sections so that the users can interact with each other and share their COVID-19 experiences. Next. This is what we envision our website to look like. Next. Yeah, that's another slide showing how we somewhat envision our website. Next. Okay, we want most of our information to be visual, so videos, graphics, infographics, and more. Next. This is an example of an infographic that could be in our website. Next. And we want all our information to be from reliable and trustworthy institutions. Some of them are listed below. Next. If we could get the general location of the user, we could give them information on a local and national level. And since many Latin Americans don't speak English, we want to give them the choice to choose their own language, so English, Spanish, or Portuguese. We also want to promote our website through social media platforms such as Twitter and Instagram. And that's an example of a post. Next. What qualifies us for this project is that we are Latin American teenagers, so we can relate to our target audience. We're also familiar with tools that will help us make the website, such as Wix, Squarespace, YouTube, Vimeo, iMovie, and GeoTargetly, and more.
Thank you guys so much. That was it for the time. Judges?
I think this was a great presentation, informed, congratulations, but I have to push back on the main posit of your presentation, that is that teenagers are somehow less able to digest or understand news than other age groups. And I have an issue with that. Is there actual research and data to sustain this assessment of yours?
We did not look for research for that, but as teenagers, we know that we don't like to read as much articles and information since we are used to apps such as TikTok and like social media, and we want the information fast, easily accessible.
We saw a problem in our environment and we're trying to address it. We don't need statistics when all we see is teenagers in their phones not caring about COVID-19 when people are dying because they don't care enough to take the precautions that they need to.
I would invite you, not just your group, but all of you, to do actual research and to see if there's an actual difference between age groups. And I think you would be surprised.
Okay.
Okay. Do we have time for another question or not?
30 seconds.
Okay, 30 seconds. Just a comment and kind of feedback. I like very much your presentation. I think it's great that you thought in a specific demographic group. I was just curious, or this thing motivated me to think on the huge inequality we have in Latin America. How will you have to plan for different contents depending of the different social backgrounds of teenagers? It's very different to live in a poor family as compared to a middle-income family. And I think you have to think more about that, and congratulations for your project. I think it is great.
Great, thank you so much. That was team number 29 to score for the judges. And next, I'm sorry, that was team 36 to score. And next up is team 29. And after that would be team 4. So who's presenting from team 29?
Fernanda Sanchurico.
Here I am. Can you hear me?
Yes, we can.
Good, great.
All right, okay.
We started.
Fernanda, yeah, we're ready when you are.
Verifying information isn't the people's favorite hobby, but what if it gets entertaining and addictive? Next slide, please. So, as a multidisciplinary team, we ask ourselves, why aren't people taking the information that they consume? Because it's boring, because they don't know how to do it, because the users want quick solutions. Next slide, please. Which problems are at the bottom of this? There are a lot of media sources, a lot of information of every kind. Next slide, please. Powerful media have these resources, but the users are still sharing misinformation. Misinformed people aggravates the health crisis. Next slide, please. Through social media, we can reach the 79% of the Latin America population, which matches with the people that aren't taking the proper measures. We can aim to the percentage in the main of capital cities, just to increase the impact. Next slide, please. The people need a fun and easy way to fact-check the information. They don't need more steps in their informative process. For this comes Coveritas. Next slide, please. A virtual assistant who answers if the source of your news is reliable or not. Next slide, please. If you identify a not recognized source and then share it with the app, you will receive experience points as Coveritas partner. Next slide, please. But how can we build the database of Coveritas? Here are these are key actors, the ambassadors. One type of them are the journalists. They will nourish the Coveritas database, reporting the trustworthy of different sources per country. But why they will do that? Coveritas has a recognition network and mutual help with ambassadors. And how will we reach them? By the second key actor, the influencers. Will connect us with the users. They are the connection with the communities. But for building Coveritas and connect with the key actors, we need to show a reliable app and human resource to support this. To solve this previous issue, our final key actor appears, the companies. Thanks to their investment in Coveritas, we will bring the project to life, have the initial boost and the force to keep it running. As we will consolidate entity, they will receive the CSR, along with being the part of ambassadors of True Network. Next slide, please. Let's unite Latin America young against COVID-19. Let's give them the tools to do it. Next slide, please. Coveritas, your knowledge assistant. Thank you very much.
Thank you, guys. Judges?
Is this idea new right now, or you have already in the past you were thinking about this?
No, we actually came up with the idea during the hackathon. I'm sorry.
You work hard.
Yes, we work hard, but this own idea.
Very good. I like it very much.
Thank you.
What would be the incentive for journalists to join and use this platform?
We know now our fast check a kind of journalist, and we know the work is doing now, but we can be a platform to connect this kind of journalists and vinculate to the application to own program.
I can say that the journalists aren't the users. They are the base of the idea.
The journalist can be the guide to be to have a base in our database, and we can connect truth information to the other people in an easy form and interactive. We think in a long time we can implement other activities to the app, because we need addictive action to the people think
We're out of time. Thank you so much. And that was team 29.
Thank you.
Thank you so much.
Thank you. And next we have team 4, and after that, it's going to be team 11. Do we have Louisa from team 4?
Yes, I'm here.
Okay, excellent. Just give us a few seconds here, Louisa, for the judges to complete their score, and then we'll get started.
Okay.
All right. Let's go, Louisa.
Let's go. What are the effects of the lack of information in a society? Hi, my name is
No se me
Luisa
escucha.
from Brazil.
Ah,
Can you hear me?
ahorita me viene a fallar esta mierda.
I can hear you. Do you
Can
hear
we
me?
mute all lines?
Hi. Hello?
Yes, Louisa, we can hear you. Let's start from
Okay.
the beginning.
Okay.
All right.
Tell me when I can start.
Yeah. We set the timer. We're ready.
Okay. What are the effects of the lack of information in a society? Hi, my name is Luisa from Brazil, and I want to tell you about our idea on how to improve access to reliable data and correct information about COVID-19 in my country. Next, please. The two main problems intensified by the pandemic that we want to address are misinformation, as the absence of authentic data provided by the Brazilian website for the disease, and fake news that spreads as fast as the virus, but this one in the internet. Next, please. The target market for our freemium services are the ones that we think that are more affected by the mentioned problems. The Brazilian people in general can make use of our fake news detector before sharing an information, and the ones with 18 years or more can hire our personal assistants. The Brazilian institutions, such as ONGs and universities, and different levels of government, such as mayors and governors, can use the same products for research, logistics, and guided decision-making. Next, please. This is the prototype of our work, a website named the Brazilian Transparency Portal for COVID-19. Its implementation can take 3 to 8 weeks, depending on the human resources and technical resources available, such as programming softwares and cloud data storage, such as the provided by IBM. Next, please. What makes us different from our main competitor, the Brazilian national website, is that we want this website to be online all the time with updated and reliable geolocated data and fake news detector using a Python bot. It will also be easier for our team to make this idea come true because we already have the COVID-19 georeference data, including all the Brazilian cities since March. Next, please. I would like to make a correction in the slide. Our team member, Ramon Ventura, is actually from Honduras and not Brazil. And in the name of the BTPC team, I want to say that we strongly believe that in times of pandemic, a correct information can save a life. Thank you so much.
Thank you, guys. Judges?
I would like to thank you very much, Luisa. I enjoyed your presentation. It's very good. But I didn't understand how are you going to implement it? And how much time you need to do it?
Well, I said it may take 3 to 8 weeks to make the website. We need just a little bit more resources because, as I said, we already have the georeferenced data since March when the COVID-19 pandemic started here. So we just need to host the website and make this data available. We want it to be online and downloadable, 2 types.
And what about the financing?
We'll be looking for donations and also partnerships. So like here in the Federal University of São Paulo, we already have like a deal with UNESCO. We help them translating a document for Brazilian Portuguese. We also have IBM team here in the supporting this hackathon. So we want to get in touch with these companies and ONGs to make our project feasible.
Okay, thank you very much. Congratulations.
Thank you.
Right. Thank you, Team 4. Next will be Team 11, and that was Team 4 for the judges to score. Right, and after Team 11, there will be Team 55. Is Eduardo online?
Yes, I'm here.
Hey, Eduardo.
Hi. I'm having a little issue with my connection, so I'll have just to keep my microphone on. Okay, I won't be able to turn on my camera.
Yeah, and that's totally fine. Yep.
Okay, perfect.
All right, we're ready when you are.
Okay, so good afternoon. Next, we are Team What's Fake, and we wanted to start off. With a question for you. Next. Do you know how to identify false messages online? It might seem a bit obvious, but we actually decided to look it up, and the results were pretty surprising. Next. We found out that over 60% of people on average in Latin America don't know how to do that properly. And even more concerning, and specifically in the case of Brazil, more than 70% of fake news content related to coronavirus was shared via WhatsApp. So we have a big problem, it's a huge issue, and that's the problem we decided to tackle. Sharing misinformation through WhatsApp. Next. So basically what we did to characterize the problem was to focus on 3 key aspects. First, breaking the chain of trust. So people do not really have the habit of questioning content they receive from people they trust. Second, there is no easy way of verifying information on WhatsApp. And third, there's no feedback. So if I shared a message last week and it was proven to be false, I'm not aware. I will never be aware of that. So then we started digging a bit deeper to try to find the motivations. Next. What we found out trying to study the personas is that it's broader than we thought. Like we could define a target audience, but what we decided in the end was to go for something that would be simple enough for everybody to understand. Next. So our objective statement would be to create a simple solution that would be universal, that everyone, regardless of background, would be able to understand. Next. So how would that work? So what would we do? So we would create a feedback loop to keep people informed and keep people aware of their information sharing habits. And we would achieve that by a solution divided in 2 parts. Next. The first part is the most usual one. It already exists. So it's basically active. So it's an information hub where people can report and receive feedback whether that content is fake or not. But we wanted to go one step further. We wanted to have another tool that is passive, the purpose will be to inform users that have had contact with the reported message that content was actually fake. So the process would go more or less like the following. Next, I would receive a message, a suspect message, I would forward it to the hub. The hub would tell me whether it was true or false. Okay, so far so good, but then we would take it to the next level. Next. The most commonly shared and reported messages would be then sent to a database of false information. And this database would be connected to a WhatsApp extension installed on everyone's phones, which would then be analyzing the conversation history. And then I would get notified if someone reported a message to be false that is in my conversation history.
Thank you so much. That was it for your time. Judges?
So I have one question. Congratulations. I like very much the presentation and the project. So when you said this last slide about spotting who spread the fake news, You mean like the number, then the phone number or the contact who made this?
No, it's actually not really about who sent it. So for example, if me as an user, so I report the message and then a verification agency would tell me if the message is true or not.
Yeah.
And if the message is false, this will get forwarded and every user that has had contact with this message.
Oh, I see, I see.
Conversation
Wow.
history will receive a notification. Yeah.
Oh, okay.
So,
thanks, Ricardo. Oh, it is great.
Thanks. That kind of answer my question as well.
Okay, excellent. Thank you so much, Team 11. Next will be Team 55.
Thank you.
Thank you. So that was Team 11 to score for the judges. And next we Team 55. After that, we have Team 3. Do we have Ricardo online?
Hello.
Hi, Ricardo.
Can you hear me?
Yes, we can.
Great.
Just give us a few seconds for the judges to complete their scoring.
Sure.
This is group
So which,
5-5, right?
Which group is this one, sorry?
55.
55. Yep. And next is group 3. And you guys can follow that on the chat as well.
Oh, okay.
Ricardo, we're ready when you are.
Okay, so let's go. Did you know that there is an invisible country in Latin America? The region has more than 3 million undocumented migrants. This is almost the same population as that of Uruguay. In countries like Colombia, although many migrants perform essential jobs during the COVID-19 crisis, less than 20% of them have access to health insurance. Even more shocking is the problem we want to solve. Undocumented migrants don't have proper access to accurate information about COVID-19. Next, please. Starting with Colombia, we want to deliver them accurate COVID-19 information. To do so, instead of adding more apps or technology to our saturated world, we plan to use existing companies that already have outreach to undocumented migrants. Next, please. Our solution is the best practices certification that endorses essential consumer companies committed to the spread of relevant information. Similar to how B Corps and fair trade certifications work, the time has come for a fact advocate seal. It would be granted by us, a third party trusted for its impartiality. Believe me, this team has the ability to create new industry standards. We will take advantage of companies' already existing infrastructure and connections to undocumented migrant consumers. Next, please. Consider this example. A Venezuelan corporation that produces food products consumed by Venezuelan migrants in Colombia. How could they help deliver accurate information and earn our certification? First, by using their packaging and distribution channels to display information. Next, please. Second, by training their employees and turning them into ambassadors of truth. Third, next, please. By using their data and marketing capabilities to build engaging campaigns. Next, please. If we win and companies hop on board, cities like Bogota could guarantee 150,000 undocumented migrants access to accurate and relevant information about COVID-19. Helping undocumented migrants access information is important. Using existing customer channels is the best alternative. There is no need to reinvent the wheel. Let's make truth reach everyone. Thank you.
Thank you so much. Judges?
I guess all of us will have something to say about this. I will leave Henriette.
Okay, I'd like to know, first, congratulations, very good presentation. But how are you going to promote the project in order to reach the target people? And how will you finance this project?
Hi, I'm a member of the team, Marcela. To answer this question, we definitely have a credibility. Like the first step that we want to take is to have the backup of organizations like the World Health Organization, so starting with the United Nations, who would not only help us bring the project to life, but maybe even endorse it and eventually take charge of this. Because at the end, these are trustworthy, world-recognized organizations, especially the United Nations. This is the most important thing. We think the team has the capability to do it, not only because we're a diverse team in gender, in countries where we come from, and where migrants are hosted, but also because we have experience, in my case, working 7 years with these international organizations on migration, and knowing that they are looking for these kinds of solutions that are beyond the digital, because the undocumented migrants, many of them don't have the access to internet or the phones that could really be easily reachable. So it's a big problem, and we believe it's achievable as a solution.
Thank you. Very good.
I think we agree it was a strong presentation. It's a very interesting way to look at the problem. However, you started making a strong point that we should focus on this population of 3 million people, and instead are offering or proposing something that looks very much like a mass communications, and that's something that will reach many more people than what you are initially addressing. So maybe about that. However, I think it's a clever way to look at the problem. Target focus is an issue.
We did think about that actually, but we were asked to focus, and oh, excuse me.
Sorry, we are out of time, but thank you so much.
That's okay.
All right, and that was team 55. Will be team 3 will be presenting, and after that will be team 7. Is Antonio online? Do we have Antonio? Can we?
Now I was muted, my bad.
Oh, excellent. All right. Just give us a few seconds to complete the form, and we'll get started.
Ready?
Yep, we're ready when you are, Antonio.
Hi, we are the Humanitarian Branding team, and we have a simple, cost-effective, and easily scalable idea to help in the current crisis. Next. Latin America is rapidly becoming the epicenter of the pandemic. Daily cases are rapidly increasing in Peru, Mexico, Chile, Argentina, Bolivia, and Colombia, just to name a few. Unfortunately, Latin American leaders have dismissed the danger of the virus, and some have sabotaged the quarantine measures in favor of economic jumpstarts. Moreover, an overload of misinformation through social media and mixed signals from leaders have created confusion and even virus fatigue, leading to poor health practices and rapid infection. Next. The little information that reaches thousands of communities in Latin America is altered with the loss of important messages and is often perceived as unreliable since it comes from leaders that people hardly trust. Impoverished areas are particularly at risk. Due to a lack of access to a diverse set of media, obtaining firsthand information from government is rare, and dependency on person-to-person transmission of information is increased. Next. Our solution: by leveraging existing distribution networks of FMCG companies and their trustable brands, we can disseminate scientific prevention education to communities in Latin America to spur behavioral change. Next. Why FMCGs? FMCGs are fast-moving consumer goods. Their producers have expansive distribution networks around the world. People trust and are loyal to the brands. They have a genuine desire to help tackle the crisis, and the low operational costs mean that we can have high impact. Next. This is where humanitarian branding comes in. Next. An initiative that uses the packaging of mass-consumed products as a medium to take clear prevention to education to the hands and homes of populations in Latin America. How? By designing a downloadable sticker that brands can easily apply to their packaging. Next. The downloadable sticker has various advantages. It contains reliable information on how to prevent COVID-19 infection. The title is based on cognitive mass media research on how to induce behavioral change, and complex information is simplified using icons, local languages, and cultural references. Moreover, by leveraging FMCG producers' already existing rewards programs such as Pepcoin, we can utilize a QR code which links to the programs and social media platforms to grant users discounts and rewards as they share pre-written, reliable COVID-19 posts with their friends online, thereby incentivizing better information dissemination and drowning out misinformation. Next. the implementation. Through outreach to corporations and local information outlets, we will encourage companies to visit our website to obtain sticker templates. Next. After selecting a country of how it's going to be done. After selecting a country of distribution to ensure that the information shared is approved by the central health authorities, companies can browse available templates and languages. Then, in exchange for a $1 donation, download the appropriate templates. Following the download, the companies can customize it to fit their packaging and choose a color scheme. Then ultimately print out the tickets, attach it to their products, and ship them out with new health information attached, thereby reaching millions of consumers who may not otherwise have strong sources of information and incentivizing them to share good information. Next. And this is our team. That's the presentation.
All right, thank you guys so much. Judges?
So it's really interesting that we saw these two pitches back to back, right? Because they are, you even use the same product. So could you discuss a little bit how would you engage, like actually engage the companies? Do you think they would be willing to let their see the, yeah?
So I personally, unfortunately, 2 of our members live in Tokyo, so they're asleep right now, and I haven't personally engaged with the businesses, but I know they've actually had interaction with Pepsi Cola and have trialed this out in a small village in Colombia, sending out packaging information with stickers on it that have COVID-19 related information. So there's a willingness there on the part of these corporations to help, and it really is just a matter of reaching out to a contact there. And most of the time that's going on their website and looking for a media contact and then just trying to work your way up through there.
And what would be the key difference in your project from what's already out there?
So, I mean, the main idea behind this is that these companies are trusted brands, and there's a big lack of trust in institutional information right now in Latin America. And by providing people with information in in combination with these products that they just believe are reliable and they trust inherently, you're giving them access to good, reliable information that maybe when it was getting to them before, it was already going through multiple sources. And so it gets skewed and gets manipulated before it gets to them. And so it's like, the way I like to phrase it is the opposite of going like viral online, because instead of trying to go viral online with the information, we're just disseminating physically the information to tons and tons of people and taking advantage of distribution networks that already exist to do that.
The time for just one question. Antonio, I would like, so congratulations, a very, very good presentation. But I'd like to know, is it a brand new idea, or you already have this kind of initiative worldwide?
It's actually not a brand new idea, and 2 of the members of the group, it's not originally my idea, it's originally two other members of the group, and they've trialed it out before in Colombia, and they actually, I think, participated in another hackathon and were one of the winners in that contest. And this just has a few improvements to it. So the QR code is one of the biggest additions we added through this hackathon, and one of the main ideas we like to, because we thought now not only are we getting good information out to people, but we're also incentivizing tons and tons of people to share the good information online as well. And so the idea is they're just like, if you put more good information on the platforms than there is bad information, and you're incentivizing people to share it, then you're able to hopefully drown out the misinformation.
Thank you so much, guys. Appreciate it. Thank you for your work. And next we will have team 7 will be presenting. And after that would be team 38. And do we have team 7 online?
Yes, hi.
Hi. And for the judges, that was team number 3 that you're scoring. Right, just give us a few seconds for the judges to complete their form.
Of course. And happy Father's Day, by the way.
All right, we are gonna ready when you are. You wanna pull the screen up, Fernanda?
It says it's like loading, so give me 1 second, please.
Okay.
I'm going to begin from the second slide because there's something wrong with the first one, okay? With my computer.
All right, I have to adapt to that.
Sorry.
It's okay, you tell me and we just kick it.
Okay. We'll do it like this. You can begin.
Is the issue with all the slides or just the first one?
It's the first and the second.
Oh.
And I haven't tried the others, but now you can see the screen, right?
Yeah. Do you have it in PDF? Perhaps that's better for like, I don't know.
No, sorry.
Okay.
Because it's not showing everything.
Okay, no problem. It's just.
Let me see if I can pull it up.
Yes, please.
What slide number was that?
That's the second
125.
One. Oh, sorry about that.
125. All right. The session will not be fun without some technical difficulties.
Part of the job, part of the life.
No, and when it happens to someone from MIT, it just makes everyone else feel better about themselves.
Dana.
You know the secret.
They're hacking us on purpose.
It stands for technology.
Dana, maybe I could screen my share.
Yeah, if you could do that would be great.
Yes.
Screen. Okay.
All right. Great. Let's try this one more time. Could you just flip through the first couple of slides just to make sure that, okay.
Yours work. Okay.
Okay, great. All right, let's just start.
Okay. Do you recall being a teenager? Imagine all that confusion, hormones, novelty, rebellion in COVID times. The pandemic has exacerbated emotional issues among adolescents. Next. One reason is the overwhelming amount of information found on social media, which is the primary source of information and communication for teenagers. If we consider that at least 90% of teenagers in the American continent use social media and that 50% of mental health symptoms start at age 14, then taking care of our teenagers is our most important thing. The relevance and visibility that we have given teenagers is not enough. We need to let them know that they are seen, heard, supported, empowered enough to cope with future challenges, but mostly that we are compelled to help them understand the world's current scenario. Next, we will offer virtual space for interaction and expression in which they can also look for help, advice, counseling. Furthermore, they will be able to read daily quality information instead of being just bombarded by it. We need to make teenagers feel represented and get them really interested. How are we going to do it? Next, we'll have 3 different channels to support and optimize mental health and inform, of course. We got social, website, and human interaction by phone. Giving teenagers active presence in social media will first reach them via Instagram. Why? Well, because it's dynamic, it's visual. We go to them and speak their own language. We will be sharing videos and IG stories with influencers, TikTokers, YouTubers, talking about COVID and sharing their own testimonials. We'll then feature scientific curated information through infographics, challenges, and games. Next. Besides, we'll have videos from doctors, teachers, scientists explaining what's their role in the pandemic, also virtual sessions, especially through our website. Next, more importantly, we'll have a phone line for active listening, one-on-one contact from volunteers specially trained. Teens can always text us if they don't feel like talking. You may be wondering, what makes us different? How are we innovating? Well, back to basics. Instead of putting technology to serve humans, we go back to humans. We innovate by honoring the human aspect. Next. Our teams from Mexico, India, Brazil, Argentina, we've got scientists a lawyer, a physician, an engineer, a journalist. Next. In a nutshell, this project intends to give teenagers tools to care for their mental health and to get better educated regarding science. Both skills are invaluable for the future of our region. We believe that crisis teaches, and this project is born from a crisis, and it will last because today's kids, your kids, are tomorrow's regional leaders. Teen matter, this matters, this matters. Gracias.
Thank you so much. Judges?
So it seems to me that you were really thinking about mental health in teenagers, but it seems that maybe you get a bit carried away and kind of steered off like the main issue of misinformation for teenagers. How do you tie both of those things?
Well, in the first place, hi Camilo. In the first place, we are also gonna curate information and have it there. And the main thesis that we had is that when you're overwhelmed, when you feel stressed out, you don't get information. That's part of the perception of the information itself. Like you need attention, perception, etc. So if you attend the real cause behind misinformation, that sometimes is that people just don't get it because they're so overwhelmed and so bombed by all the information and they are feeling bad about everything. Well, then you get it.
Any other questions from the judges? All right, thank you so much, guys. And,
okay.
Thank you.
Ignacio, do you want to switch?
No, I'm fine.
Okay.
Great. So up next is team 38. And for the judges, that was team 7 that just presented. Just make sure that you guys are submitting these forms live. And 38 is up next. And then after that would be team 1. Do we have Corinne on?
Hello?
Yeah, hi. We
can hear me?
Yes, if you give us a few seconds, get the judges to finish their scoring and we'll get moving.
All right.
All right, let's go.
All right. So COVID-19 is the black swan of our generation, a completely unpredictable, unprecedented event with severe consequences. In every crisis, information is key. But who should we believe with so many potential places to get information? Next. Misinformation can perpetuate the spread of the virus and be a matter of life and death. This problem is particularly rampant on social media platforms driven by fear and uncertainty. In 2019, there were over 282 million users on Facebook alone in Latin America, which provides a lot of opportunity for misleading information to spread. How can we differentiate what's fact from fiction in the emotionally charged times of the pandemic? In black swan situations, the truth is our best asset. In times of misinformation, we need innovation. Next. What they need is Audify. Audify is unique in that it collaborates directly with any social media platform, integrating its software to provide site-wide coverage. Using an integrated automated system that uses machine learning techniques, we can fact-check COVID-19 related posts in real time, empowering users with accurate information through automated verification. The way Audify works is simple. It's like Turnitin.com for your social media. When you post COVID-19 related content, Audify works automatically with social media platforms to check key phrases against a database full of scientific, peer-reviewed sources compiled from government agencies, universities, and open source journals. Next. Audify can assign a score to the post based on how many sources in the database support the claims in the post. Posts containing information verified with many sources will receive a high score, while claims that aren't verified by the database or match with few sources will receive a lower score. Next. Currently, social media platforms rely heavily on user reporting to fact check or flag bias information, leaving many misleading posts unchecked. We want to challenge social media platforms to themselves take more responsibility to prevent the spread of inaccurate COVID-19 information. Social media claims to have fact-checking software, but not all of it is automatic, and the automatic systems that currently exist fail to provide site-wide coverage. Next. Audify will also provide users resources where they can get access to accurate information, empowering them to make informed decisions about the content they post. Next. Currently, government education agencies fund projects like these through grants. This project could be continually funded through social media platforms paying for continued coverage of their platform. Our diverse female team, composed of experts in the life sciences, engineering, international affairs, business information systems, and medical professionals, truly believe in using the power of accessible information. Next. Audify. Automated, accurate, and empowering. Next. In short, we believe trust Audify and not auto lies. Thank you, and we will take questions.
I have a question.
Okay.
Congratulations for the presentation, Corinne. Two quick questions. So you mentioned about using machine learning, but what type of machine learning would you recommend for this type of spotting the fake news? That's one. And the other one is that, I mean, I totally agree that Facebook is very, very relevant and important source of information in Latin America, but getting into the private post is not trivial. I mean, it's almost impossible. You can trace the public posts in Facebook, but getting into the private content would be like a real challenge.
Yeah, the private content is definitely a challenge, and I think our approach focuses more on like the public posts that people make. And as far as the algorithm goes, we were hoping that it could make use of linguistic characteristics to detect misinformation using machine learning and like natural language processing technology. Our system will handle the vast variety of verified and reliable information in our database, since computer algorithms like learn from samples. So it's key that it's sufficiently representative, and that's why we would also collaborate, hopefully, with research centers to make best of both worlds.
Thank you.
So do you reckon that your way to go about fact checking is fundamentally different than what Facebook or other social media companies do?
Yeah, so I think the problem is that the current systems are ineffective. Many people say that social media platforms have these fact checking, but I mean, I don't know about you, but I see misinformation on my feed all the time. So obviously it's not implemented system wide, or the systems that currently exist are just not effective, which is why you just need verification of every post that has to do with COVID-19 related content. Does that make sense?
And how are we going to finance this project?
So there are lots of companies like UNESCO that would be perhaps interested in collaborating financially, since their goal is also to stop misinformation, but it also gives empowering tools to social media users so that they can learn about COVID-19 from, you know, selected and trustworthy sources.
Thank you.
And this also aligns very well with the goals of universities as well.
We're out of time. Thank you so much.
Thank you.
Thank you, guys. Next, we have team number 1 presenting. And after that, there'll be team number 19. And for the judges, that was team 38 that you're scoring now.
Can we start?
Not yet. Just give us a few seconds, Victor. Thank you. All right, let's set the clock. And we are ready when you are.
Let's just start. Hello guys, we are team Grokking COVID, and we aim to make COVID a subject that's easily understandable by everybody in this room. Next. So we have a growing problem with fake news in Latin America. People are swarmed for information coming from different sources as Twitter, Facebook, and WhatsApp chains. This information has no face. We don't know where it came from. It's unverified and it spreads very fast. Next. This brings us to a state of pain where the citizens cannot interact with these information. We lack the tools. We feel overwhelmed on a daily basis. We're surrounded by information which we cannot navigate. Next, please. The problem, we struggle understanding this information regarding coronavirus. We feel confused. We are flooded. We need a solution which brings scientific information easily available for every citizen, which empower the citizens to take decisions, which support them in forecasting. Next. We have a view. The information must be mined, filtered, tested. We want to deliver a simple solution with basic metrics, which can be easily understandable by everybody, and run them against the complex models which the studies have been released so far. We gather only truthful data from government agencies and give them the people a tool where simple variables are moved. We believe in sliders, we believe in a graphical interface which allows to take decision making. Next. It's viable. People would sponsor us. They would want to have a seal of supporting truthful data. Software companies would give us free hosting and tools. People could donate to have a badge. And principally and mainly, B2B communication channels. If I want to invest, if I want to know what's going to be the forecast of my investment, how I'm going to act regarding these problems, this tool can provide real-time insights for everybody which has access to it. Next. Will you join us? This is our team, and this is our dream.
Right. Thank you guys so much. Judges?
So I can ask a question then. So my question is, well, first of all, congratulations for the presentation. It was a good one. What could be different in your platform as compared to many other platforms around to visualize the data on COVID?
We attack it threefold. First of all, we look for verified data. Secondly, we give people simple metrics, things they can relate to. I can relate to the number of beds, I can relate to the population of my city, but I don't necessarily understand what's an R factor, which is the factor which gives the increasing of the disease speed. So we want to make it relatable. The keyword here is relatable. People must relate to that and they can see the future. And this tool also goes to the past, so you can get feedback and believe that that's truthful data.
Do you have any previous experience in this model?
We've seen that long time ago. We had a predictor for the bus tariff in Porto Alegre, where you could change the factors and see the outcome of the bus tariff. It was made something like 15 years ago, and now I feel old.
Okay, was it. Thank you so much, Team 1. Next up would be Team 20. And after that is Team 9. And for the judges, for your scorecard, that was Team 1 that you're scoring. And please just make sure that you're submitting those forms live. And
I can hear you.
Yes, we can.
No.
Just give us a few seconds here to complete the form. We'll go. All right. We are ready when you are.
Awesome, thank you. I guess I'll start then. As COVID-19 began affecting our communities, next slide, please. Data and information were one of the most important tools at our disposal. Could we change the slide, please? We saw international communities continue sharing data and helping other neighboring countries prepare for the pandemic that was about to come. However, there have been situations in which government officials, either through negligence or for ulterior motives, have failed to provide the public with accessible and reliable information regarding the pandemic status. Can we switch 2 slides, please, that we didn't change the first one? This creates 2 major problems. First, people lose trust in what the government is saying and thus can end up ignoring, sorry, the slide, can you pass 2 slides?
Nancy, are we able to move the slides?
1 more, please. Thank you. This creates two major problems. First, people lose trust in what the government is saying and thus can end up ignoring the recommended healthcare guidelines. And second, it prevents people, be it policymakers or just ordinary citizens, from taking data-driven action as they don't really know the situation that they're in. Next slide, please. This begs the question, what can we do to obtain truthful and transparent information from our governments? What we're proposing is to create an index through which we can measure a country's management of COVID-related data. Next slide, please. So far, we have identified over 40 indicators that would make up the index. This would be broken down into 4 major categories: health, methodology, historic data, and privacy. Health would encompass all variables related to the tests per day, hospital capacity, disease per day. Methodology would focus on the methodology that was used both for collecting the data as well as how testing and its organization took place. And make sure it's up to standard. Historic data can be useful to predict trends. And finally, privacy, as there are some governments that are collecting tracking information due to the pandemic. So how can we put all of this together? Next slide, please. What we're proposing is to use a website, as you can see from our demo, in which we can rank countries accordingly by their indexes and see what areas they might be doing well in, as well as what areas might be lacking and we can be improved upon. This can be a powerful tool for civil societies, allowing them to see how they might be ranked against their neighbors, as well as see the specific indicators each country needs to do better on. This allows them to petition the government effectively and ask for information specifically. Next slide, please. As for our methodology to implement this on the ground, we plan on joining forces with key partners such as universities or NGOs, not only for them to aid us in collecting all the data regarding their country, but more importantly, to build off the credibility that universities tend to have, as sometimes the government lacks it. Collecting some of the information might prove to be challenging, as governments can sometimes be the sole source. But we believe that with the help of our partners and tools like checking for death discrepancies and listening to healthcare workers, among others, we can materialize this idea into reality. Next slide, please. In terms of the value proposition, we would be improving people with the clarity they need in order to take data-driven action, including, again, both policymaking or just individuals acting what is best for their communities and families, hopefully even easing the state of mind of many who are frustrated at the unknowing of the current reality. Thank you.
Thank you guys very much. Judges?
Thank you for the explanation, but I would ask you, do you think that this project could influence positively leaders like the president of Brazil, which is terrible? He doesn't believe in coronavirus and things like that. Do you think it will be some impact on those presidents or anything? Well, you understand.
Yeah, definitely. I understand your frustration. I've been there myself with my country in El Salvador. And I think that the more people we can get involved in, the more the civil society supports this program and we can get more people into it and using it as a viable means to measure government response, I think we can effectively push governments to be more open about this flow of information that is so essential.
Oh yes, even yes, because of the society may do this role. Yes,
definitely.
Pressing the president and the Ministry of Health. Okay, thank you.
Jorge, thank you for a strong presentation. Are you confident? Are you sure that this isn't already being done?
So we've looked for some similar indices and we found like freedom of information, like in the United States, you have different freedoms, but we couldn't find a specific one tailored to COVID. In this case, something like the transparency of information. Do you have, for example, healthcare officials that might be saying something different than the official statistics? We couldn't find one that like encompassed all of them, and it was our vision to get them all together into this ranking.
I have one quick comment. No question, but I like very much your presentation. We tried to do something similar in our webpage in Mexico. We didn't succeed, but I see a huge potential to expand your scope and doing it to assess not only national governments, but also local governments. During the COVID and the pandemic, local governments become more relevant, more important because of the type of measures that they're taking on. So you can definitely expand your scope to incorporate local governments.
I fully agree. Thank you for that. We'll be sure to add that in.
Timeline.
Hello?
Yeah. Thank you guys very
So
much.
let's go.
That was team number 20 for the judges to score. And next up is team number 9. And after that would be team 14. Again, that was team number 20 to be scored. And team number 9, here we go, I see you.
Yeah. Can everybody hear me clearly?
I can hear you, yeah. Just give us a couple of seconds. We'll get the judges done and we'll move on.
Okay, no problem.
All right, I'll set the clock and we're ready when you are.
Thank you. What if your company was recognized as a big fighter against fake news? Next slide, please. Every day we receive information through our phones. This information is lacking in scientific data and reliable sources, and sometimes tends to be absurd, like coronavirus spreading through 5G. According to Forbes, 1/3 of the population of Brazil, the biggest country in Latin America, consumed some sort of fake news in 2018. Sometimes there will be some scientific basis for the information, but it may be misinterpreted and poorly disclosed, creating confusion and possibly even danger for the public in general. Next slide. We live in the era of smartphones. Communication, information, and transactions are all done with a few touches on the screen. In lower income families, the newer generation usually have access to smartphones and are more educated than their parents. By 2025, over 70% of this region's population will own smartphones, showing that this is a valid platform for spreading information. Next slide. We want to make trustworthy, solid, simple information more accessible through an app called Apollo, inspired on the Greek god of truth, healing, and the sun. This app would function as a link between the less educated and most susceptible community within the academic society. The app has 3 main features: a Q&A with a bot using a database that is updated with the latest information using text recognition software. The What to Ask feature helps the user to build a question, helping people to know what they want to know. The third and most interesting feature is the Ask a Professional. Next slide. The question is sent by the user to a volunteer who receives a notification, answering it, providing trustworthy source, which is then double-checked by other volunteers. Next slide. You may ask, why is our information reliable? Well, those volunteers would go through a test provided by the indexed institutions. The app would require a student or professor ID, so to avoid fake profiles and the spread of even more fake news. Every question answered by a volunteer will be checked by at least 2 other volunteers. The answer would be sent back to the user only if approved after the checking. Next slide. This app would be financed through companies that want to be recognized as one of the toughest fighters against fake news. This idea makes it easy to expand the project to broader areas, covering a myriad of different topics. In order to expand this idea horizontally, we thought of a stamp, resembling those of the cruelty-free companies or the Rainforest Alliance. This is the model that inspired our financial plan. Next slide. The Apollo stamp would be used on these companies' products. This would give these companies an edge on their competitors, as the well-informed population tends to be more careful with fake news and would choose companies that are actively helping to fight this issue. Next slide. Reliable, simplified, scientific data at the tip of your fingers. Welcome to the dawn of knowledge. Welcome to Apollo. Thank you.
Thank you, guys.
Thank you. I have a question. Congratulations.
Of course.
We have already a lot of fake news checking agencies. How do you differentiate from these agencies?
So the work of, this is not a fact-checking app. This is an app to facilitate the communication between the less favored parts of society, the ones who don't have, who are not in touch with academia, creating a link between these people and scientific society, so students and professors from indexed institutions.
I see.
So if someone read something, a news on the WhatsApp, and then they could go to the Apollo app and ask for a professional to answer this question.
It's a personalized service.
Yes, exactly.
Okay.
Any other questions? All right, that's great. Thank you so much, guys.
Thank you.
And next up, we have team 14 as presenting, and after that's going to be team 18. For the judges, that was team number 9 to score. And do we have the presenter from team 14?
Yeah, I'm here.
Hey, Antonio.
Can you hear me?
Yes, you can. Just give us a few seconds to complete the judging and we'll get started.
Okay.
All right, let's set the clock. And we are ready when you are.
Oh, so there are almost 9 million of COVID cases in the world. And this is produced by people that don't follow recommendations, or people that follow recommendations but follow bad recommendations. And this is produced because there are a lot of misinformation on the internet. Indeed, the recent studies show that, for example, Google, when it gives you some COVID results, 70% of these results contain low quality content, and 41% for the tweets as well. Plus, 70% of Latin Americans don't recognize fake news. So both together can negatively affect health outcomes of people. Next. On the other side, we have scientific publications during this pandemic. And these scientific publications are in PubMed. And it contains around 22,000 scientific publications about just COVID. However, social media and news, they are not used in PubMed. Most of them, they are not used in PubMed. And why? There are two main reasons. Because it's difficult to understand, because of the technical terminology, and because it's not well organized, as you can see on the right side, a piece of a paper. So our main goal is to provide accurate and reliable information as well. How? Next. So we provide a knowledge graph called CoVinfo. So this knowledge graph is created from scientific publications, and then we represent that as a knowledge graph, and which is a set of data points. And this is a powerful way to represent data. And this was built with artificial intelligence methods like natural language processing and machine learning methods. Next. What is the usability of knowledge graph? Well, for real scenarios, knowledge graph plus other artificial intelligence can be used to detect fake news. So next, we created a website called CoVerify. So it's gonna allow us to introduce some text that we want to verify, and then it's gonna give us the correct statements and the false facts as well. We are providing this one as well as extension for the browsers like Firefox, like Google. Next. So at the end of the day, we have two main valuable things. The first one is the knowledge graph that we created from scientific publications for the verification, and this is available already in GitHub. And we are providing as well, we will provide the CoVerify, which is a website, and which will be a browser extension as well, but with deep evaluations. So this both thing is gonna help us to reduce misinformation, and which is gonna help us as well to make more informed health decisions. In this way, we are gonna improve our outcomes. So this, for the total pipeline and with the integration and with the deep evaluations as well, we're going to need around 1 month in total.
Okay, thank you so much. You're out of time and you're done.
I'm done as well.
Okay, great. Thank you. Do we have any questions?
So, very good presentation. I didn't understand. You said you need 1 month to implement the project?
No, we already implemented, but a basic pipeline. But to go in, with the whole data set, we're going to need we're gonna need 1 more week and then 1 more week for the evaluations, and we pretend to do a research publication of this work, because there is natural language, there are artificial intelligence methods to build everything, but we need 1 month exactly to evaluate, because we need to be sure that the knowledge graph that we're creating from scientific publications are good. And we are gonna need as well in the other side to verify if these applications that check that verify news, it's accurate as well. So that's why.
And what about the financial support?
Well, there are grants, national, our main objective is government institutions, because it's mainly this pandemic needs to be done, needs solution for now. So that's why they need to invest on this one, because they need to support mental health of people. They need to support as well that people are well informed with reliable information, with information that comes from scientific publications, peer-reviewed publications, not open repositories like medRxiv created by Yale, for example, because you can put there a work and then, but it's not verified, it's not peer-reviewed. There is not a jury that verifies this research.
Understand. Thank you.
All right. Thank you guys very much. That was team number 14 for the judges to score.
Thank you.
And coming up next is team 18. After that, it would be team 25. And do we have Lorena online?
Yes, we are team 18, just to...
Yeah, team 18. Yeah, did I mistake that?
Yeah, because the presentation says 19. Just to be correct.
Okay.
Coming up next afterwards.
Okay. All right, let's go ahead and get started.
Perfect. Yep. Next, please. Okay. Go. B COVID. B for viral communicators and COVID for the pandemic that we are going to help. And next. We often hear the expressions, why should I wear a mask? Why should I wash my hands? I am tired of this. Does the virus actually exist? In LATAM, we are not just confronting a public health crisis, but also an infodemic. Next. Our mission is to inform the purely educated and vulnerable people in our communities through different channels, such as WhatsApp, Facebook, and corporate partners. Next. That's why we create Be COVID. My name is Lorena Ramirez, and I am co-founder of Be COVID. We are a media outlet with inclusive, accurate, and creative, easy to understand information for everyone, built on a foundation of generally accepted health principles, established by reputable sources of information like WHO, CDC, and renowned university. Next. But also, we want to make our people part of the solution. That is why we launched a weekly communication challenge. Here, you can see how the user interface will look, clearly outlining the essential information that each submission must adhere to, empowering people in LATAM be content creators. With this, we are bringing awareness and conscience around this issue through the creator journey. Next. Our campaign will be simple, focus on the most basic practices to beat the pandemic. Next. Since our staff of curators will leverage artificial intelligence and machine learning to help curate submissions, content deemed with original and innovating, receiving the most votes and engagement will be the face of the campaign and will win a monetary prize. We will then expose the content to a multi-channel network. Our goal is to teach the most people with the most accurate content available after initial curation. We will run a variability test on various social platforms and analyze saturation and impressions to help select content for the masses. Next. We estimate that we can more than cover our costs and have significant impact on poorly educated people in LATAM by pursuing a multimedia channel approach. Our business model leverages corporate sponsors looking to create brand equity and social goodwill to positively impact the health of the poorly educated. We expect operating costs to remain low as our staff will be limited to need volunteers and content will be generated by external partners who will share in revenues as the content goes viral. We will build credibility through partnerships with academic institutions as the foundation of our content curation. Next, our team. We are a diverse with multicultural backgrounds and multidisciplinary professions. This will allow us to complement us and have different perspectives and approach of what we are addressing. If we are informed, you take care of you, I take care of me, and we take care of all. Thank you.
Thank you very much.
Thank you.
Thank you, Lorena. What about the language? Are you going to have just in Spanish or Portuguese also?
We are thinking of addressing Spanish, Portuguese, and also English. Since many of our resources could be in English, we will have a core team to actually translate the information that maybe we think it's very useful for Latin America too.
Okay. And what about partnerships in the countries?
For example, I'll give you an example. We are thinking about, there is a huge baking company here in Mexico that is called Bimbo. So for example, we know for certain that every house or home here in Mexico, they have a piece of bread of them. So for example, if we actually launch the campaign, we can have corporate partnership with them, first of all, to expose the campaign, but also to make conscious through them about our campaigns and also about the virus.
Because I think partnerships will be a very important part of the project. I think.
Totally, yes. And also, for example, we are willing to be partners of the MIT, Harvard, the Tec de Monterrey. You know, like we need accredited and go-to sources that actually already exist, but we want to communicate their content in a more creative way.
Thank you.
Thank you.
Thank you, Lorena. This is an excellent presentation. Did you consider the possibility to actually work with existing media outlets rather than creating the novel new outlet?
Yes, totally. Actually, what we want to do, first of all, for tracking or just to launch the idea, we want actually to find the most accurate information existent out there that could be viral by this time, so we can actually share. And also, we do focus a lot in being inclusive. For example, we haven't seen something that actually focus on deaf people, you know, or indigenous people. So if there is actually content out there that is very useful, we want also to be the source to go to these kind of vulnerable groups.
Thank you, guys. That was all for
Thank you.
Thank you. And that was team 18 to score 18. Next up is team 25. And after that would be team 27. And do we have Dennis online?
Hi.
Hi, Dennis. Just give us a few seconds to the judges to complete their score, and then you will be up.
Okay.
All right. Let's set the clock.
Okay.
Ready when you are.
All right. So hi, I'm Dennis Moura, and today I'll be presenting for Team 25. Next slide, please. This is João, a shop owner from Recife, Pernambuco, Brazil. With the information he gets from the news and government, he has no idea when he'll be able to reopen for business. Therefore, he cannot plan accordingly, buy his merchandise, and he tell his employees when they'll be able to come back to work. Next. And how control this pandemic as João state or city or street? Next. Next. And as for government and policymakers, what areas need more attention? Go back, please. Just the slide. Okay. And as for government and policymakers, what areas need more attention when you have limited resources? Next. And how effective were the quarantine, lockdown, and distancing policies so far in controlling the spread of COVID-19? Next. Are we close to the end of the quarantine at local level? Next, please. With almost 9 million affected people worldwide, we still have the problem of lack of reliable information about COVID-19 cases and the local directionality of the epidemics. Next. And we can help answer some of these questions. Next, please. The COVID-19 Directionality app uses historical data and presents local situation reports about the progression of the disease. It is based on spatially adjusted time-varying reproductive numbers, meaning we can estimate how controlled the pandemic is at a local level. Next. And how this helps answer our problems. Information is key. Knowing the directionality of the pandemics will help us understand which policies are good or bad and tell us when it's safe to relax the isolation. Next. So what's innovative about this app? Next, please. And next, and next. Our solution answers those questions by presenting a trend direction of the data in an accessible language. Next. And is it viable in the long run? Yes, we already have a fully functioning MVP for Brazilian states as a case study. We can bring this solution to any other part of the world in a scale from country to street level where there is availability of data. Next, please. And will João, the shop owner from the beginning of this presentation, be able to use it? For the general public, the app presents a simple, accessible daily report about COVID-19 in the user's location. And an in-depth technical report is available for specialized public. With a click from his computer or phone screen, João will check his location situation, and he'll be informed from trusted source if it's safe yet, or if it's time to demand more effective actions from the government. Next. And why us? We are a data-driven team of scientists that want to make a world a better place by the power of unbiased information. Next.
We're out of time. Thank you so much, guys.
Thanks.
Judges, any questions?
I have a comment and a question. So congratulations for the presentation. It's great. I like very much the first part when you spot the challenges and kind of this trade-off that we live in Latin America about the economy and the health. But I think in the final part of your presentation and the tool, I mean, the tool is great, but I think you need to think more about on how to go further with this tool because it's very focused just like on health. It would be interesting if you can balance some data or forecasting for, I don't know, the economy, unemployment, or like that, like what you represent in the first part of the presentation, but have, I don't know exactly the way, but what I say is you should think about having a way to incorporate those type of economic variables into the tool and the visualization, where the people can kind of balance that trade-off between the two.
Oh, that would be great. We will think how to implement this in a future version.
Thank you.
Thank you.
Well, congratulations. I also liked very much the presentation, but I think that there are other agencies that are already doing this kind of statistics, and how are you going to deal with that? Aren't you repeating the same job?
So the innovation was, as I was talking about, is that we present a trend which is hardly seen in those analyses in the news and in the government official reports. And with this trend, we can predict or see how the policies are going, if they're going good, if the acceleration of the pandemics is going up or down. So we can do this trade-off. We can understand better how to treat or if the isolation can start to relaxate or not.
Okay, you're out of time.
And we're using. Okay, sorry.
Yeah.
Thank you.
All right, and that was team 25 to score for the judges. The next team up is team 27. And after that would be team 17, which I believe that would be the last team for the day. Do we have Rebecca on from team 27?
Yeah, can you guys hear me?
Yes, we can. Rebecca, just stand by for a few seconds and we'll get started.
Sure, thank you. Is it possible to start my video?
Oh, do you want to switch? Is it then the next slide?
Oh no, it says that I'm unable to start video because the host has stopped it.
Fernanda, you want to look into that?
I think the host has stopped people from turning on their videos. I think that's the same case with Rebecca. So if you could allow Rebecca to turn her video on Zoom, I think that would be wonderful.
Yeah, okay, let's try to enable people's video. That was probably not intentional. Thank you for letting us know.
Rebecca, is it working now?
Yeah. Okay, great. Let's get set the timer and we'll be ready when you are.
Great. Recently, my mom came home from the store with a pound of onions, rushing to tell me, "Quick, Rebecca, eat these." I read on WhatsApp that they prevent coronavirus. Although I might have just gained a vitamin C boost during dinner that day, the spread of misinformation among private messaging platforms, particularly WhatsApp, is one of the most dangerous byproducts of the pandemic. Next slide, please. WhatsApp has 2 billion users worldwide and has a 65% market share in Latin America. Next. Numerous claims of COVID-19 cures are being forwarded at alarming rates, falsely persuading people to take drugs like chloroquine phosphate that has been advertised to cure the virus, but has caused multiple hospitalizations instead. Next. What exacerbates the issue is the widespread lack of trust in Latin American national governments, keeping people from cross-checking information they receive on social media. Next. WhatsApp has seen a 40% increase in usage since the beginning of the pandemic. Misinformation particularly has an impact in more elderly populations who are 4 times more likely to disseminate false information. Next. There have been attempts by WhatsApp and the WHO to implement a fake news chatbot, where users can look up claims they've heard, and the bot will respond with whether the claim has been proved false. However, these current solutions are difficult to use, they're ambiguous in their responses, and above all, people are simply not aware of them. Next. That's why my team and I have created What's Right, a user-friendly and reliable solution to the WhatsApp disinformation crisis. What's Right is an accessible tool that connects WhatsApp users to the International Fact-Checking Network, a database available in English, Spanish, and Portuguese that has compiled all COVID-19 related falsehoods. Next. We have divided the prototype into 2 phases. Phase 1 is where users can forward any message to a fact-checking contact, Sally, who analyzes and provides feedback on whether it's false or not. Next. Phase 2 would be an upgraded version where the fact-checking option is integrated within WhatsApp, removing the need to talk to a chatbot. Users simply select a message to be verified, and What's Right then attaches a tag to the message, ensuring that if it's forwarded again, people are notified of its status. Next. We plan to implement it in 3 phases, focusing on partnering with local governments who are much more trusted by the Latin American community, a beta bot, and then later releasing the final version. Our objective is to make it a habit for users to fact-check messages with the bot first, before forwarding it to others. Next. With how ubiquitous private messaging has become, it has never been more crucial to ensure people are receiving information accurately, because accurate information saves lives. Choose what's right. Thank you.
Thank you very much. Excellent timing. Judges?
I think that other groups have built on a similar concept. I don't know if we checked this, but did you actually check that this would be possible that it would be feasible working with WhatsApp directly to implement something like this type of integration?
Okay, so I'll take that question. So WhatsApp is definitely over the past few months and for the past few years actually has been dealing with the fake information. The fake information is almost linked with WhatsApp to a certain extent that comes. And they've actually been trying to counter this issue and have invested over $1 million in the IFCN, which is the International Fact-Checking Network. And they're actually looking for individual organizations like us to actually pursue this and actually create a feasible model that can help so. So we are actually using the IFCN, which has over 4,000 database sources that actually verifies this across different platforms, and it uses only reliable sources. Yeah, thank you.
Yes, they also have a grant that is available for groups of up to 50K.
Okay, so one quick question, just to clarify. So you plan to compare these messages against that database, right? It's not like any natural language processing or something that you do by your own. Am I right?
That's correct.
Okay.
Yes, that's correct.
Okay.
This is a very imminent and challenge that needs to be solved right now. And so we decided to use current systems and technology to roll out a solution immediately. And then later, once we lobby with WhatsApp and work with them, roll out the end final solution, which is integrated into their application. But first, it's the chatbot.
Oh, okay. Thank you.
All right. Thank you, guys. That was team 27 to score. And I love the background you guys all got. Very nice.
Thank you.
Next is, last but not least, is team 17. And do we have Hector? I see Hector online. Excellent.
Yes, here we are.
Hey, Hector. Just give us a few seconds here. We'll get started.
Of course.
All right, let's set the clock.
Okay, so let's begin. Next slide, please. The lack of efficient, abundant, and affordable COVID-19 testing has brought widespread health, societal, and economic issues to LATAM. Next, please. Our proposal is to harness the available infrastructure that FEMSA Corporation possesses all around LATAM, using the approximately, next please, 20,000 OXXO convenience stores that are as fundamental parts of our initiative. Given their amazing geographical distribution, they would be able to ensure the health and well-being of their surrounding populations. But how could this be done? Next, please. This could be achieved with the installment of automated testing booths, where instantaneous private tests will be performed to a sample of the daily visitors to the OXXO convenience stores. The finality of this recollection of data in a cloud-enabled encrypted database is real-time analysis and connectivity to existing contact tracing apps that could follow the specific movements of individuals who participate in this voluntary testing. Next, please. The impact of having wide available testing in a huge geographic area to OXXO convenience stores is that an important range of the population could get tested very quickly in a more precise manner. The main beneficiaries, of course, are the people who normally don't have the means to get the test by a hospital or a lab. Having this automated service will also allow to have much more precise results, and most importantly, it will allow the non-infected and immune to resume normalcy in a secure and swift manner. Next slide, please. We are considering the usage of technology that is widely available to an open source to build the online database, where all of the testing results and personal metrics will be safely captured and stored in an encrypted form. Also, because the technology is continuously improving, we look forward to working with the companies that have already finalized their testing equipment, while being open to interaction with many other startups who are developing novel, fast, and more affordable testing that could be compatible with the initiative. Next, please. This proposal can start off its phase 1 with just a few dozen OXXO stores, conveniently selected in densely populated spaces throughout all of the Republic, and it can be scaled as much as it is needed. Next, please. We believe individual behavior will dramatically change once people are empowered by the certainty of not being potential carriers of the virus. Using blockchain certificates, the boots installed in the Oxos will issue a unique immunity certificate that determines if they are ready to reincorporate to society or not just yet. Fighting COVID-19 will be just the initial catalyst that LATAM needs to improve its health exponentially. Thank you for your attention. Any questions?
Well, thank you for the presentation. Hector, who is going to pay for the tests?
Yes, actually, that's one of the main concerns we have right now. And it's the fact that we would like to have strategic allies. For example, in the presentation, we showed one of the automated tests. I think it's from Bosch. And we would like to partner with these other enterprises for the test and for them to help us carry out this initiative.
Yes, this is of main importance because this is the main point to succeed with the project.
Yes, I think, if I may add, that the reality of the project is more using the already existing infrastructure to potentialize the use of technology, because technology is already there. Technology is ever improving, and we know that there are many automated tests out there and many enterprises that are keen on carrying out this to the population. So we would just like to potentialize the reach of said technology.
Okay, thank you.
All right, and that will conclude our presentation for today. Thank you everyone for sticking around and for a great job.
Yes.
As a next step, the judge is gonna now go to a separate room and complete their scoring. And for this session will close, that we will be posting the Zoom link for the award ceremony that should start somewhere between 4 and 4:30. So just watch the channel on Slack, and we will post when the time will start for that with the link. All right, thank you everyone, and congratulations. You guys all made it. Great job.
Thank you. Dana, I'd like just to share a quick comment of 30 seconds. I really enjoy and like the presentation, and just would like to encourage all the teams in general to think in governments. You have great ideas, and in almost all of the speech, I noticed that you think separately on the government. You even think on the government, but governments in this pandemic and COVID-19 in Latin America have to play a huge role. So also think in this, if you think on the public impact of this, you need to consider like the role of government could play in your startups and ideas. Thank you.
Thank you very much. Anything else from the judges?
I will also congratulate everyone. I think it was very encouraging to hear so many insights and ideas and proposals to be able to address like this main issue of the truth in regards to the COVID-19 pandemic. If I may, I would like to invite all the groups to, if you're working in this area, to really assess like your basic assumptions and also review those starting points, under the light of evidence and research, and do not build a startup or a project solely from a commonly held idea that might also need to be subject to actually verification, right?
Thank you.
And I was amazed that it was really impressive. So many good ideas, but the time was so short that it's almost impossible. I was stressed by the need to ask more, but there is no time for that. So I think this is to be continued.
Exactly. This is only the start, actually. So this is
just the start point.
And we hope you guys all will build up more on your ideas. And there will be post-hackathon information about where else you can help build more on these ideas. So stay tuned with that. And with that, we'll wrap this up. And for the judges, I posted the next on the channel, our next meeting link. So we'll see you guys in the other room. And for all the participants, thank you again so much for all of your hard work. And we will see you guys around 4:30.
And the Zoom link is also in the chat for judges.
Great, thank you so much.
Where is the link?
Thank you. Oh, yes, here.
In Slack or in Zoom chat?
Okay, so let me copy this and then we'll go to.
You exit.
So at four,
no, we are joining the judges right now. We can exit this one and move to the next room right now at 4 o'clock.
Congratulations, everyone.
okay.
See you soon.